Hey everyone, this is Jane with Barlow Herbal, and as you can see, I have a special guest today. This is my friend, Dr. Joel Kahn. I'm going to give you his bio, and then we're going to get into a really great conversation that I know will be really relevant for you and family members and people to share, because this is a relevant time to take care of your health, especially your heart. So Dr. Joel Kahn is a practicing cardiologist in Detroit, Michigan. We were actually just saying before we started that he's stuck in Detroit and I'm stuck in Utah. But they're both lovely places to be in the summer, right?
Best time to be in Michigan right now, unless you're a snow fiend, and we like the snow too. So I'm stuck and happy. Right.
That's true. So he's known as America's Healthy Heart Doc, which I love. He's and I didn't know this about you, Joel, but you're triple board certified. Internal medicine, cardiovascular medicine, and interventional cardiology. And maybe I can just stop right here. I understand what those words mean, but what exactly is that?
Well, interventional cardiology historically refers to cardiologists who've trained special to do balloon angioplasty and stent placement, which I have trained. I've done thousands. But I now intervene with sprouts and herbs and tinctures and essential oils. So I intervene in other ways, but that's not what they give you the board certification for. It's the ability to, mechanically repair arteries internally.
Okay, gotcha. Yeah, that's cool.
I routinely see arteries improving through natural approaches, which is what I focus on now exclusively.
Yeah, that's one of the reasons when I first met you. It's been about 6 years now. I totally resonated with you because I could tell that you were just this different kind of doctor that was like, let's take a different route than just opening you up for surgery, right? And sending you off with some medications. So that's what I really love about you. So there's a whole bunch of stuff here I could read, but I just want people to know that you've authored 5 books and you have a 6th one in publication, which that's something that I've never heard of, the lipoprotein A. I've never heard of that, so I'm glad we're going to talk about that.
Come up with an herbal solution for it too.
Yeah, for sure. Yeah, I mean, I'd love to hear what that is. I mean, I actually did some research on that prior to getting on with you.
Okay.
But that's awesome. So you've been on Dr. Oz, The Doctors, Larry King Now, Joe Rogan, Bassem Youssef. I mean,
you knew me back when nobody knew me, now. Occasionally Hollywood says we need funky, kind of interesting cardiologists. So yeah, it's been a fun ride, and I hope the world will allow all that to continue.
Yeah, well, I think it will. And I think now more than ever, the message that you put out and the message that I put out too, is that now is the best time. It's the most critical time to take care of our health and really take action. It's not just something you can put off till a later date or when you have time or your spouse supports you or you retire. This is the time, because the first question I want to ask you is, okay, we're in a COVID era, and is worrying about your heart still important? Like heart disease, is it still important? Because we're all scared about the virus and taking precautions about the virus, but what about the rest of you? What about your heart? So what do you say to that?
Actually, it's literally like we were talking right before we went on, people have responded to your amazing business, and you're busy because people are taking care of their health. There's more reason than ever to focus on heart health during COVID. There's always a reason. Number one killer of men and women, number one cause of disability of serious nature in the United States. 39-year-olds drop dead, and 55-year-olds, men, women, every gender, every ethnicity. It's a real deal. About 2,400 people a day die in the United States of cardiovascular disease, and many way too young. But with COVID, we've learned a couple things. We don't completely understand why one person is exposed and barely is sick, and one person's exposed and could die. But we do know that the same list we talk about in heart disease, obesity is a really scary deal right now. It's clearly elevates the risk of heart disease, but it is a factor in why many people don't do well with COVID, diabetes, type 2, high blood pressure, and the existence of heart disease. So wrapping your head around the idea, which we haven't heard much from governmental figures and governmental doctors, and without being too political about it, Bill Maher did an amazing video in the last couple of weeks, 5 minutes, on why the government should be talking, let's lock down fast food restaurants and let's make vegetables free, and let's make, messages of fitness and sleep and stress management by every technique, because it's not window dressing right now. It may quickly save some lives. So it's more important than ever. And just to finish up, it is now understood that this virus can directly affect arteries, maybe directly attack arteries. And, you know, the classic and horrible example of his name, if I remember, is Nick Cordero, a Broadway actor who died recently of a, you know, seemingly healthy 1-year-old baby, wonderful wife, Amanda Klotz. And he had blood clots everywhere. And we're finding that this virus can actually damage arteries on top of already cholesterol, smoking, blood sugar, family history. And so having good arteries, that is a theory why children are very rarely sick with COVID, apparently, is just naturally, they probably have healthier arteries than the average 50-year-old. So we can make our arteries healthier starting today with diet and fitness and sleep and nutritional proper supplementation and quit smoking. And so yes, heart health and COVID are two circles of a Venn diagram that have a lot of overlap.
Yeah, and I guess the crazy thing is this kind of conversation is just not sexy at all. It's like time to eat clean, time to stop
broccoli. You know, you've heard broccoli. You know, kale. I mean, yeah, but it really matters. You know,
it does. Well, and when you were saying that, you know, there's healthy people. I have a very dear friend, 45 years old. Died of a heart attack about 3 weeks ago, 5 kids. And there was a lot of stress. On top, he lost his job because of this. And he didn't really have the tools to manage it. His gym closed because of this. So he didn't have the pressure valve. Sure. So it's like, you know, I've kind of myself been a little confused. Like, why are we keeping fast food restaurants open, but we're closing the gyms? Yeah, right. You just...
doing you know, liquor stores, cannabis stores are open, churches and gyms are closed. It's a whole, but if I may, that little vignette you just gave is my stepping point. It's been my platform now for a decade. Yeah. That we have a medical system that doesn't address a 45-year-old dropping dead. Because I guarantee you, if that person had an autopsy and there was blockage in the heart arteries, which is possible, sad, but possible at age 35, 40, 45, you know, you go to your doctor at 45, 50, and they're going to say, go get a mammogram or a thermogram, but there's no breast lump. Look, this is what we do, preventive breast health. You go at age 50, you need a colonoscopy, but I don't have any bleeding or hemorrhoids. I know you need to make sure you don't have a silent little polyp as a predictor of future colorectal cancer. You go to your doctor at age 40, 50, 60, 70, maybe you get an electrocardiogram, but actually insurance companies don't want you to get that now. You get your blood pressure, your blood done, which is all important. We're not looking for heart disease, and there are ways, not complex, not expensive, not elite. I do executive physicals, but I do them on school teacher budgets, and I do them on, you know, police officer budgets, and I do them on retirees, because most of what needs to be done is labs through your insurance lab, and maybe one heart test, which is a CAT scan of the heart. That poor gentleman, undoubtedly 6 months or a year earlier, could have been identified as an at-risk individual, could have had some wraparound, mainly natural therapy. Maybe his cholesterol was 400 and he needed drug therapy too, unknown, but we're missing the boat. I'll just leave you a vignette. In 1955, a Harvard professor took over the care of President Eisenhower when he had a massive heart attack. He was a brilliant man named Paul Dudley White, MD, and he announced, because he was one of the first docs figuring out heart disease is actually predictable. Do you smoke? What's your diet? What's your stress? What's your weight? And he announced in 1955 that a heart attack after age 80 is God's will. A heart attack before age 80 is a failure of the medical system. 1955, no CAT scans, no cath labs, no treadmill tests. But when you talk about a 45-year-old, that's how I feel. We failed that family. We failed that gentleman by not doing proper labs and maybe offering them a $75 CAT scan at a local hospital in every city in the United States called a calcium scan. And we need to be more aggressive, you know, emphasizing the real, it's easier to prevent than to reverse. So let's teach healthy diet, healthy fitness, healthy sleep, don't smoke, monitor your weight, and get lab work, which includes this new cholesterol topic that is the topic of my 6th book we can talk about. But, you know, we just failed them, and that just, you know, I won't stop doing what I'm doing. I've been doing it for 30 years because the need is huge, and it's just so meaningful to teach preventive health in cardiology. That's still a little novel. sample.
Yeah, I agree. So where do you put, so you said the medical system fails people, but where do you put the personal responsibility piece in there? Like,
Right.
I mean, there is that big, huge chunk of, if I, like, there's, to me, that's huge. Like, and that's how I run my health, is I'm 100% responsible. And so where do you put that chunk in? Like, how do you,
So
there's got to be a balance, not just the medical industry failed.
no doubt.
So
If that individual or others, did see a more progressive internist, family doc, preventive medicine doc, nurse practitioner, and there are blood tests such as a quick CAT scan of the heart without any needles, and you refuse to do it, you're uninterested. Of course, I mean, that's patient responsibility, and they failed themselves potentially. Everybody knows that smoking's an adverse habit.
yeah,
And there are people that don't want to discuss it. I've got cardiac patients in my practice, and I have brought it up enough times, I can't bring it up anymore. There's personal responsibility, and there are self-destructive habits that can be alcohol or food addictions. But that is where the role of psychologists and family support, and patients, because sometimes on the sixth visit there's a little breakthrough and they are willing to be a little open-minded about change. So clearly personal responsibility is a big deal. Most people know good sleep, exercise, clean diets of a variety of sources that don't involve McDonald's, Arby's, and Hardee's are the right thing, and don't smoke. But a medical professional has a responsibility every visit to bring it up. I rarely have patients in the hospital, but I had a patient in the hospital having an elective heart procedure 2 days ago, and yesterday morning he sent me a picture from his cell phone. It was bacon, eggs, and a donut on his tray on a heart floor. Believe me, don't look shocked. That's every day, everywhere, everywhere, everywhere. That's a cardiac breakfast the day after heart procedure, is bacon, eggs, and a donut. And
why would he send
probably
you
the
that
audience would
picture?
argue, which is worse? Is the donut worse? Is the bacon and eggs worse? The whole thing's, a poor choice on a heart floor. So, the messaging isn't happening in hospitals. Doctors are stressed. They're not educated in nutrition and lifestyle generally. So that in your 12-minute appointment, you may not get 45 seconds on lifestyle. So, if we could, as they say, let's pull the plug on the medical system and reboot it and build it as a preventive system. But we're not going to do that, but we're going to go piece by piece, doctor by doctor, nurse by nurse, medical student by medical student. The young students, nurses, pharmacists, they're getting it. I mean, they really are much more inclined to, know about plant-based diets, fitness, and good lifestyle, the impact of lifestyle.
Yeah, well,
Uh,
you can see. If all you have to do is look around you, look at look at the things that they suffer with. I mean, chronic disease is
yeah.
at a crazy all-time high. But what surprises me is that your patient would actually send you a picture of his breakfast, knowing what you thought about that. Like,
Well, yeah,
what the heck?
he has converted from a meat and potato eater to a largely plant and salmon eater.
Oh,
Lost a
okay.
ton of weight, brought his cholesterol and blood pressure down, improved his sexual function. He's a pretty happy guy. That all happens with healthy lifestyle. But yeah,
Yeah.
it's still shocking when you're in the hospital and you see it. But it's everywhere, and it's I'm relentless about criticizing hospitals, because that opportunity to teach. You're in the hospital and you got a bowl of oatmeal, walnuts, and berries, and your family comes and visits, and the cafeteria has a gigantic salad bar and tempeh and quinoa and educational signs, even if it's just green, yellow, red. And they still got some red foods, but it's clearly labeled as, suboptimal choices. I mean, if you want to keep some freedom for people to choose, but none of those messages are there. So we end up
Yeah.
with chronic disease and cancer and chemotherapy and bypass surgery and
Yeah.
even autoimmune diseases. So much illness is responsive and reversible with lifestyle, from autoimmune diseases, cancer, diabetes type 2, heart disease, blood pressure, cholesterol, erectile dysfunction. I mean, bring
Everything.
some joy back in life.
Well, the crazy thing is, to me, is I don't think people understand how quickly their body can turn around, their health can
Yeah.
change. When you make some of these, if you're willing to take the big leap and really jump into swapping all of your bad choices for completely good choices. The human body is miraculous.
Miraculous. I could agree more.
Miraculous.
2 to 3 weeks. 2 to 3 weeks, you're having chest pain playing tennis because of clogged arteries. You dramatically change your diet. You'll see 90% of people improve. 2 to 3 weeks, your joints are sore, your psoriasis is flaring. You change your lifestyle. You have proper supplementation with omega-3, flaxseed, or whatever. You'll see your joints and your psoriasis improve. Your blood sugar, 10 days on get rid of processed food and fast food, and you go on a really, bright, colorful, fiber-rich whole food diet. You can see your blood sugar plummet. You have to actually be careful and maybe tail back people's medications because they respond so quickly.
Right.
I agree with you completely. It's remarkable. There's a famous plant-based doctor, Michael Greger, that uses example. If you knock your shin on the coffee table and it's all swollen and sore, but 4 hours later you hit it again, and 4 hours later you hit it again, you're never going to heal your shin. Well, that's what most people's diet is like. We're causing inflammation and damage, and we do it at lunch, and we do it at dinner, and we do it the next lunch. All you got to do is just stop, and the body will bring in, the ability. We renew our blood cells, we renew our artery cells, we renew our skin, we even renew our bones every 7 years. Our bones completely are different cells than they were before, and some of these changes are absolutely quick and dramatic, and that's how you get patients hooked when they see, if they're symptomatic and they see the difference. You get them to stop dairy, and first time in their life their nose isn't stuffy in the morning in 10 days, and their stomach isn't gurgling and causing social eruptions. You've got them convinced that diet is really a food and a medicine path.
Yeah, you know what else I think? I think people have never experienced what it feels like to have good, vibrant health in their body, and what it feels like to actually lay down in bed and get a full, beautiful night's sleep because they haven't eaten a really heavy, meat-heavy, fat-heavy meal right before they go to bed, or just ate a bunch of sweets. So when you actually bring your body into the way it's supposed to be, I don't think most people have experienced that. So they're caught in these habits. Their environment isn't conducive. They have all this food in their house. They're used to going through fast food for breakfast or lunch or whatever. And their family brings in junk food and fast food. And so it's almost like it can be daunting for people, but if they were willing to make this swap and just try it, right, the way that they would feel, I think that's what I see from people that aren't willing to change. They just don't know not only how fast your body can change, but what it feels like. Like I have zero problem sleeping unless I have some really big issue on my mind. I just can't shut my brain off. Then I'll get up and journal it. But other than that, I can't imagine. I'm 60 next year, and I sleep like a baby.
You're so young.
Right? Well, you're young. How old are you?
61.
Oh, well, hello. We're the same age.
Pretty youthful looking 59-year-old woman, and everybody knows it. And it's genetics matter, but look how much you've worked on your lifestyle and your diet and used natural products. And
since I was young, this is not something I
have a positive attitude. And it doesn't guarantee, but it sure does maximize the odds. What you're saying, and I just want to nail it home. Everything you're saying has science behind it. In the cardiology world, we have science. 2 to 3 weeks, alteration in your diet, dramatic improvements. Actually, one meal impacts your artery health adversely. You have the classic study is a McDonald's sausage egg McMuffin within an hour has a dramatic negative impact on your arteries. That's how quick these changes occur. But there's this classic study done at the University of Pittsburgh. They took inner city people eating inner city urban fast food at the University of Pittsburgh. And they found a similar age match, gender match group actually in South Africa living in rural areas. They did every blood test, every stool test. This was just published a couple of years ago. The most sophisticated genetic, epigenetic, biomarker study. And the cool thing was, for 2 weeks, they flipped their diet. They actually fed in urban Pittsburgh root vegetables and tubers and twigs, and they did fast food in South Africa. And within 2 weeks, everything good became miserable in these very advanced measurements, and everything miserable in Pittsburgh became dramatically better. And that's how quick your microbiome and metabolism and the byproducts can change for the better, for the worse. So yeah, we're all 2 to 3 weeks away from a dramatic improvement in health. But
Yeah,
just you
it's
got to
really
believe it.
cool.
That's why they're the 21-day programs. It's a very reasonable time period to say, what if you give up dairy for 3 weeks? You know, go buy some oat milk. Stomach's
Yeah.
better, skin's
Well,
better, your energy's better, your nose isn't stuffy. You might realize this is a good plan for the long run.
well, and the thing is too, when you change your taste buds, because I think that's what a lot of people think
Yeah.
they're going to be giving up all these tastes that they love.
Right.
You know, sit me down with a great big salad, and I
Sure.
am the happiest girl on the planet. So let's just talk really quickly before we do some more of these questions. But uh, what would be like, like helping people move away from a meat heavy, animal product heavy diet? Give me a couple of your quickest tips that you can say, here's an action step that,
You mentioned, the foods you love. And one, you have to have an open mind. You can't,
yeah,
we say you can take a horse to water, but you can't make a human eat what they don't want to eat. And I believe that. There's theories of behavioral change, Prochaska's theory. And there are some people, I don't care what, they have cancer, they have heart disease, erectile dysfunction, diabetes. They're going to, die with a McDonald's burger in their mouth. You just got to be patient and kind. But for most people, it's just a lack of information. My protocol is now Netflix. I want you to watch, Forks Over Knives 2011. I want you to watch What the Health 2017. And I want to watch the Game Changers movie 2019. They're all plant-based movies, but I only do that because if they make a 10 or 20% change, if they do oatmeal instead of eggs and bacon every morning, most of the week, it's an improvement. I don't expect them to, be 100% adherent after that. But it's so eye-opening to see so many different people talking about their health improvements. But, you don't have to give up the food you love. Probably the best person that I deal with, there's a Dr. Neal Barnard at Georgetown who's written 25 books. Dr. Barnard's program on reversing type 2 diabetes is just an amazingly powerful book to give a patient. And I have many copies in the corner of my office I'm looking at. But he talks about don't give up the food you love. But if you like chili, maybe try a bean chili instead of a beef chili. And he's actually more lenient than I am. If you like pancakes and bacon and sausage, maybe do pancakes and try a veggie link or a veggie sausage, which most of us wouldn't put up there with a big salad. But, you can realize, and now with the Impossible Burger and the Beyond Meat Burger, which I'm not a big fan of, but, you can make substitutes that are completely plant-based. And if nothing else, you've helped the environment and the animals if you choose wisely. I have no ties, but I'm not a big fan of the Impossible and Beyond Meat Burger. Their ingredient and saturated fat content is rather high. But Trader Joe now has plant-based burgers and turkeyless burgers, and their ingredient list is phenomenally better if you're not willing to make your own and you just want some store-bought convenience, because that's a lot of it, is uncomfortable cooking new meals, but simple transitions. If you like breakfast cereal, just upgrade to maybe a whole grain cereal and get some oat milk instead of cow's milk. And, you can still have the things you like to start with.
yeah, and that's a great tip. All those 3 documentaries you
By
talk
inch.
about,
Just little inch by inch baby steps. I mean,
yeah,
if I have a really sick patient, I may have to give them, full court press. We need to seriously talk about starting tomorrow, and they will often do that. But for the others, I'm very, very lenient about by next visit. Here's 2 or 3 simple goals: education and 1 or 2 changes in your diet.
yeah, and there's a reason that baby steps always comes up in everything that you're trying to do that's a big change, because they compound over time.
Right.
It's like there's the compound effect. But the three documentaries that you mentioned, I've watched all of them several times, and I've sent them and encouraged many family members and friends to watch, especially Game Changers when that came out last year. Very impactful. And then Dr. Barnard, I love him. I've been following him for 30 years and I've read most of his books.
Seems like a very mellow, gentle man, which he is, but he's actually very intense about 1, health, 2, animal experimentation in the medical world, because most of this is changing over to computer simulation, and you don't need to dissect a frog when you can do it. And, you know, it's just a passion of his that I honor, even though there are some, you know, medical experiments using animals that do help humankind quite a bit. But he's just very straightforward. And his books, his new books on hormonal balance using healthy whole foods, and they're very simple recipes that really are approachable. You know, we don't need to be cordon bleu chefs and we're spending an hour and a half sauteing and making mirepoix. I mean, can of beans,
That's where you go to the fancy
sausage, mustard, boom, you got a meal for a family. You know, that's getting expensive. We can worry about upgrading it down the road.
Yeah. Well, you know, one of my quickest tips for people is to don't let yourself get too hungry. You know, that way you're not going to be tempted to go through something that's quick and easy and fast and processed and unhealthy for you. You know, keep some stuff with you. Like when people can get that habit in, keep a baggie of almonds, keep an apple, whatever.
I had my lunch a couple hours ago. I'm in Eastern time zone, but I got my secret weapon snacks. You know, if I get hungry, I mean, I spend a lot of my practice educating people that fruit is not evil. There's just, you know, some of our friends that we know have, you know, taught that sugar is evil, and certainly added sugar beverages, Monsters, Red Bulls, are, you know, they're pretty evil. But fruit is a complete food that should not be feared. And, you know, it blows people away. The scientific data that the more fruit you eat, the less type 2 diabetes you develop is overwhelmingly strong in the medical literature. Exact opposite, not apple juice, not orange juice, but, you know, the whole, these are little mini oranges, of course. And it just like, but I heard a guy on TV that said that, you know, we shouldn't eat fruit, but oh my God, over a donut, over a cookie, over a chip. I mean, it's the ideal thing to eat.
It's nature's fast food. Banana, oranges, apples, and I eat so much fruit. And honestly, I've never had a problem. And there's my dad and my mom are both one of seven siblings. All of them, including my dad and my mom, all of them diabetic. All of them. Yeah. So, and it's so every, so I
statement, diabetes runs in my family, because nobody runs in my family. Right. You know, diabetes runs in my family because everybody runs a McDonald's in my family. It's probably more lifestyle than actually the genetics of developing type 2 diabetes. Because there is a genetic component, but it's much more crowded out by a heavy meat and potatoes diet, inactivity, high saturated fat, butter, lard. These are the reasons people develop obesity. People who develop type 2 diabetes. So you're doing a good job. You're changing the whole family tree.
Yeah. And so there's 14 kids in my family. And you knew that, right?
Yeah.
Yeah. And only one has fallen into the diabetic, is in our genes, and she's on a couple of prescriptions and you know, but other than that, the rest of us are like, F that. That is not our destiny.
Freedom.
Freedom. That's what it's for. That's what it stands for. Okay. So let's I don't know if there's a short answer to this question, but where does heart disease come from? Is there a short answer to that?
There's a shortish answer. I mean, big spike in heart attacks after World War II in the United States prompted much research and investigation. The big 5 were identified. We all know these. Smoking, double, triples your risk. Developing type 2 diabetes or acquiring type 1, double, triples your risk. Having high blood pressure requiring treatment, having high cholesterol, which can be genetic or could be the McDonald's, Burger King diet. And finally, mom, dad, brother, sister having an early heart attack or stroke. Some of that's genetic and your lifestyle won't eliminate. But again, mom, dad, brother, sister may be eating the same suboptimal diet and associated lifestyle. Big 5. Now, there actually are more than that. But those are the easy controllable ones. Go to your doctor or get a home blood pressure cuff, get your cholesterol, get your blood sugar done, don't smoke, and know your family tree unless you're adopted and don't know it. We have added 20 other measurable factors, which is what I do in my clinic. I want to know your lipoprotein A, your homocysteine, your inflammation, your omega-3. There's some other genes that you can measure. So you know, when we talk heart disease, we're talking generally clogging your heart arteries. And so we know that there's more factors now than we ever identified. And most of them have, you know, most of them actually resolve with lifestyle. The same diet that lowers your blood pressure, lowers your blood sugar, lowers your blood cholesterol, lowers inflammation, lowers your waistline. And it's largely by the science, whole food, plant-based, brightly colored, largely or completely, you know, plant diets. But we shouldn't, the tragedy, as you said with your 45-year-old acquaintance, is clogging of arteries. There are some clues. When a man comes to his family doctor internist and says, I'm having trouble having erections for the last 6 months, the answer is, here's your prescription for sildenafil, tadalafil, Viagra, Cialis. That's okay, but the real question should be, maybe you're clogging your arteries up. Let's get all these labs and let's check your heart. That doesn't happen, and it's supposed to happen according to all the guidelines. That's a clue. Losing your hair on top of your head, turning gray early. These are little clues. There's a funny one, and I want your listenership to know this. 50 years ago in New York, a really bright internist said, when I'm sitting in my office and I'm talking to a patient with heart disease, I've noticed a little crease in their earlobe. And he called it a diagonal earlobe crease, DELC. Just go look at a picture of Steven Spielberg. You'll see a real deep crease in his earlobe. Turns out, forgotten, and now with CT scans of the heart, it's been confirmed. It's about 70% accurate. If you see that crease, children don't have it. You may have a clogged heart artery. It's just another reason to get checked. So it's 30% wrong, so don't freak out right now, anybody listening, if you're looking in the mirror and you see it, or go over to the search engines. I used to say Google, now I say duckduckgo.com because it's a more secure search engine, and take a look at a picture of a diagonal earlobe crease. But it takes years. It takes years. You know, like right now, the ketogenic diet and even the carnivore diet is very popular. And I have friends on every range of the diet spectrum. I don't yell at people. I just was on a carnivore podcast last week with Dr. Sean Baker. And not too many vegan doctors, you know, hang out with him for an hour. But, you know, they've changed their diet dramatically, and they're pretty proud that they don't have heart disease or cancer. These things take a decade or more to develop. And I'm not wishing any disease on these people. But, you know, feeling good is great. It doesn't mean you don't have heart disease. You've got to go an extra step. I live by this hashtag, test, not guess. Looking great, feeling great is a wonderful achievement in life. But you want your lab work to be great, and you probably want to once do a more advanced heart test. Let me just, this is not an advertisement, because I actually don't own a CAT scanner. Hospitals own CAT scanners. But this might show up. This is from a brochure I have for patients. There's a 5-second CAT scan at the hospital for $100 that shows your heart arteries. Your bones are supposed to be full of calcium in your teeth. Your arteries are supposed to be free of calcium. And for $100 in 10 seconds, no IV, no injection, you get a report that says my heart arteries have 0 calcium. You have now achieved what Dr. Dudley White said in 1955. You have really defined where you want to be. And I'm telling you, at 61, I've been a 0, and I just had it checked again. I do it about every 10 years. Same amount of radiation as a mammogram. So it's not much, but you don't do the test over and over. But, you know, not enough people are doing that. And I work in some free clinics in Detroit. I can't send them for a stress test. That's a $2,000 test. But I can tell them, can you scrounge up $75 and go down to the local hospital and get this? So it's not about elite and status. It's actually available to almost anybody. And you know, it's just ironic, even though we've had 25 years in science, it's just barely being taught to family docs and internists. So usually it's patients hear about this on various resources. Just a good thing to do for most everybody once.
Yeah, no, this is all valuable information, because I think when you have knowledge, then you can take the appropriate action. That's always the way it is with everything, right? Okay,
Absolutely.
so this is where heart disease comes from. Can it be prevented, and can it be reversed?
Yep, that is, like, again, these are hot button questions that you researched well. We have data it can be prevented. And of course, the lifestyle features, if you don't smoke and you avoid developing high blood pressure, high cholesterol, and type 2 diabetes by as early as you can in life, adopting a healthy lifestyle, which is where we should teach it to kids, teach it to young adults. There are some nice studies out of Europe. We had 40,000 people. that denied having heart disease. We asked them a zillion questions. 20 years later, we went back to find out who had a heart attack. Well, those kind of studies have identified you're about 85% successful in preventing a heart attack if you do 5 things. They're going to be the same things. They're boring. Don't smoke. That shows up. These are what are called multivariate statistical analysis. Don't smoke. Number 2, do fitness 30 minutes a day. That's what came out of these studies. Number 3, try and keep your waist thin. That's kind of an interesting one. Less than 40 inches for a guy. It's not a hyper aggressive goal. Less than 35 inches for a woman, because that visceral fat around your waist is really where inflammation and metabolic syndrome and leads to prediabetes and diabetes. So that's number 3. Number 4 is very strange. Number 4 is allow yourself occasionally have a glass of wine during the week. Now, don't do it if you don't drink for religious reasons, alcohol, addiction, tendency reasons, liver disease reasons. You don't like it. But I'm just telling you what shows up in these studies. And number 5 is eat more than average fruits, vegetables, whole grains, and legumes. These come out of these studies worldwide. It's not United States, it's not Japan, it's not South America, it's everywhere. So by doing that, 85% reduction in heart attack rates is a big number. If you started that at age 20, it'd be 95% reduction. All that's left is a rare genetic influence that lifestyle alone can't really wrap itself around. So yeah, absolutely. And then I think you said, is it reversible? And that's the most exciting thing that I do personally in my practice, which is starting back, you can go actually even before, but at least 1950, we started to get science by forward thinking, out of the box physicians doing science and publishing it, that you can take people with advanced heart disease and you can see improvements, like we said, in 2 to 3 weeks, but you can cut their risk of death over a decade in half or more by eliminating saturated fat, butter, lard, cheese, meats, getting them to walk, getting them to quit smoking. The pioneer that gets most credit, but not the first, but the most elegant, is Dr. Dean Ornish, who did very, very accurate studies that you can actually see plaque slowly start to go away, just like slowly it comes on. And as you do that, people feel better, their sexual function improves, their blood pressure improves, and their hospitalization rates and need for procedures. So Medicare now pays. If you're a heart patient, you can go learn who Nathan Pritikin, an engineer from Santa Barbara who's passed on, but his program called the Pritikin Reversal Program, still, Medicare pays for it. Blue Cross pays for it. And they also pay for the Ornish Reversal Program because the data is so overwhelming. The insurance companies know if a patient will embrace these lifestyle-oriented programs backed by science, they're going to cost less than bypass, cost less than having a heart attack and ending up with congestive heart failure or needing a stent. Bypass surgery can be between $45,000 and $450,000 for one little operation. You can have a whole lot of cooking classes and yoga classes that'll never, account for 1% of the cost. So these are not controversial topics. Sadly, they're rarely available in most hospitals and cardiac programs. Your local hospital and mine should have an Ornish program and a Pritikin program at the various hospitals. We have 2 in the state of Michigan, and California has 2 or 3 of them. These should be dozens because of the power of prevention, proven by science.
Yeah, I totally agree. In fact, Ornish and Pritikin were some of the first nutrition books I ever studied. A long
Good
time
for
ago.
you. Yeah,
No,
they're powerful book.
They're timeless because, like you said, the research, the studies, they don't lie. And there's so much data now that you can't deny it. So here, let me switch gears a little bit because
Sure.
I don't want to take up too much more of your time, but I know there's a big thing about butter being healthy now.
Right.
So I want to hear your thoughts on that.
You hit a hot button because it intersects with the topic, who do you trust? And hashtag fake news, which in 2020 is unfortunately, it can leave you sleepless at night, and you're going to have to go to Barlow Herbals and get some good sleep aids to calm down, some valerian or such. So I'm sort of a medical historian. When this rise in heart attack came up, scientists wanted to try and identify why so many heart attacks, why are people dying? Not just in the United States, Finland, oh my God, 45-year-old men were dying in Finland in 1968 and 1970, more than any other place in the world, actually. And the research ultimately, just to go through it, suggested the higher the amount of saturated fat in your diet, butter, lard, certain meats, cheeses, baked goods, croissants wrapped in butter. The higher your blood cholesterol, the higher your heart attack rate. And then even in Finland, they did a countrywide research program. Let's put beans in the sausage and let's put healthier margins in butter. They lowered the saturated fat content. They showed countrywide 85% reduction in heart attacks in 5 years. It was one of the most dramatic examples. You know, the United States and other countries generally institute the recommendation, you know, you should watch and limit the amount of saturated fat by lowering the amount of butter, cheese, lard, ghee, and others, marbled meats, even fish, turkey, pork, all have saturated fat, whereas plants, with the exception of coconuts, have very, very little. That was all fine and dandy till about a decade ago. There was some new science, wasn't good science. And we've been fighting it out on the cover of Time magazine and books like Big Fat Surprise. So about 8 weeks ago, just to tie it up, the most esteemed scientific research group, they're called the Cochrane Database out of London, put together all the quality data in the world. And they published, they said, lo and behold, you lower your saturated fat by cutting back on your butter, your cheese, and your marbled meats, you lower your heart disease risk. Everybody agrees the Cochrane analysis is the top of the pyramid. It's the best science you can find. Not one headline in any newspaper I can find in the world celebrated the Cochrane database because it conflicts with meat money, butter money, egg money, and the rest. I wrote some articles about it because I thought it was pretty amazing that it confirmed all these years. Within 2 weeks, and I think it was just coincidence, 2 articles came out. Quality, about half of what the Cochrane database is. One of the papers, 12 authors, 9 of the 12 authors are funded by meat, dairy, and egg boards. It's in the paper.
Yeah.
They independently said, we think saturated fat is okay and everybody should eat. Hundreds of headlines around the world have emphasized the 2 inferior studies, and nobody wants to talk about. It's the way of the world. I strongly believe, and it's still very much the cardiology tradition, you lower the saturated fat in your diet, you will lower your risk of heart disease. Your cholesterol, you want to bring your cholesterol down without medication? Give yourself a month without cheese, butter, lard, marbled meats. You know, eat plant-based for 4 weeks, you'll see your cholesterol drop. Some people phenomenally, some people a little less. There are genetic influences. But it's a really political discussion because of the dollars that are going on. The USDA every 5 years comes up with new guidelines for America. The preliminary reports are on track. Plants, not animals, as a trend, lower saturated fat. But there's going to be a war, as there is every 5 years, to see who really wins the ear of the politicians and the administrators that put together the final guidelines.
Yeah, it always is. It's kind of, history repeats itself continually. And people love to hear that something that,
something that's a comfort food that they're used to is good for them.
Right.
Because that's easier than making a change. But we have missed the opportunity. You know, people argue it's the U.S. and American Heart Guidelines that have led to the rise in obesity. Well, you know, 1981, the USDA said eat far less sugar than you're eating now. Do you think America listened? I mean, no, they didn't listen. I mean,
no. Okay, well, let's get to your lipoprotein A.
Cool.
Because this is your new book that's coming out.
Right, and you and I got to get together and we got to come in with a new herbal creation that'll be a solution. But
you know what? I would actually love to collaborate with you.
We could.
I would love that. Yeah.
We will talk after, but we've talked a lot, actually, I think pretty good detail, blood pressure, cholesterol, get your labs, don't smoke, exercise. Even if people do all that, there's a little piece left of people that still have heart attacks, people that still have strokes, people that drop dead. It's called residual risk. We've done lifestyle, we've added proper medication if needed, you've had the procedures if needed, still bad outcome. So scientists are always searching what else is streaming through our bloodstream that is clogging up our arteries, causing blood clots, and causing people to die of strokes, heart attacks, losing legs, losing sexual function. Turns out in 1963, a Swedish researcher found a molecule in the blood, previously never known, called lipoprotein a. It's a terrible word. No marketing company would pick it. I'll just, so people can see it, lipoprotein a. It doesn't even have the word little, but it's a lowercase a. And identified it's a kind of cholesterol. It's made in the liver completely different than the other cholesterol family. It doesn't show up on the blood work that you've had 1 time or 10 times at your doctor's office, no matter where you are. It's another box you check, and it costs about $25. Well, what's the big deal? 1 out of every 4 persons inherits this from the genes of their parents. So that 90 million Americans from the time they're 1 year old have a blood level of this cholesterol in their blood, and it stays high if they're 1 in 4 people, which is extremely common for a genetic disorder. What does it do? It causes inflammation, it causes plaque in your arteries, it causes one of your heart valves to get clogged up in most people, and it causes blood to clot more than it should, which is strokes and heart attacks involve blood clots. So when you look at why do some people do it all right and still have events, that's called residual risk. Actually, this cholesterol is the biggest portion of why that still happens. And it has gotten almost no attention by the medical community. Thousands of research papers. We know what gene, we've sequenced it, we know where it's made in the liver. There's still a few things to learn. There's no pharmaceutical drug that's approved for lowering it and reducing your risk of heart attack and stroke. So there's kind of a nihilism. Why do we teach medical students? Why do we teach doctors, nurses, physician assistants? Why do we teach the public when we're not sure what to do about it? Well, on the one hand, some people would like to know if their family history is of high risk. Every lab does this. Quest, LabCorp, your local hospital. So there's nothing exotic about trying to get your lipoprotein (a) blood level done. And if somebody's got a family history of early heart attack, early stroke, early blood clot, I tell them right now to do it. In Europe, the scene is changing, and they're now adding it routinely to their routine annual blood work. Younger, the better. I would tell a young person who finds out they inherited this, you really need gym, food, fitness, sleep, don't smoke. Get the habits earlier in life. You're probably going to be fine. It's not absolutely certain if you inherit this that you're going to have a problem. And the blood level can vary from a little elevated to sky high. But all of a sudden, the pharmaceutical industry has a drug, a company called Novartis. The trial is starting right now, 7,600 people. Inject yourself once a week with a real or placebo. I hope by 2024, 2025, we will see a very positive result because we need this drug. People are literally dying of this problem, have died of this problem. And all of a sudden, we'll have a $15,000 a year pharmaceutical, so doctors will be detailed on it. There'll be grand rounds. I wanted to jump the gun because there is such a huge amount of data, and there's some really wonderful academic docs that know 10 times as much as I know about it. But this is the first book written in the world by a physician on the topic. And there are some options even now. Whole food plant-based diets help. Niacin, a B vitamin, helps. L-carnitine, an amino acid, may help. Hormone replacement therapy in a woman postmenopausal may lower it. Taking a baby aspirin a day if your blood level is very high. There's actually even a theory, not proven, that some of the blood clotting in COVID-19 may be that 1 out of every 4 persons with COVID has an elevated lipoprotein A. This causes enhanced blood clotting, and there's a theory, and now it'll be tracked down in studies. So for me, it's a passion of awareness that we still have lots to learn about heart disease. I'm very hopeful we still have lots to do to benefit people about heart disease. I think it's largely going to be a pharmaceutical solution. There's not a lot of people looking at pycnogenol or try and come up with some, grapeseed extract or other endothelial or artery-friendly substances and see what happens. Just to conclude, you certainly know Linus Pauling, PhD. Mm-hmm. He, towards the end of his life, 2 Nobel Prizes that he won. He lived to age 94, I think. Interesting guy. His whole focus at the end of his life was on vitamin C and its health benefits. So he wrote a paper in 1990 that I believe the solution to lipoprotein A, because it was known in 1990, he was up on the biochemistry, is to add more vitamin C and lysine by eating citrus. I'm all prepared here. When the interview's over, I peeled my orange. And lysine is found in lentils and other legumes. And he was also a proponent of using supplemental doses to get them high, but that it actually may counteract, even if you inherited lipoprotein A, from having any impact. So there are some, natural food-based approaches, there are some supplemental approaches, and then there'll be increasingly pharmaceutical approaches. But in the meantime, if you want the European approach, just ask your doctor to draw it. The probably has never drawn a lipoprotein A blood level. lipoprotein little a. And if you particularly have that high risk family, definitely get it checked. I solve the mystery, 2-3 times a week in my clinic. People come to me, my whole family's been decimated by heart disease. Nobody can find a reason. I'm just concerned. Labs come back and I can just predict that they're going to be super high in this. And then we come up with a program. But I mean, it's like the next coming wave of ways to benefit, the burden of heart disease in this country.
Yeah, that's fascinating. So this is the book you just showed is your newest book. It's not out yet, right?
No, it is now out. It's very recent.
Okay.
LIPOPROTEIN, the heart's quiet killer. And very honestly, it's very inexpensive. Half of it is recipes because people like that. And half of it is science written in a very simple way. I mean, the science is a 2-hour read and the recipes will keep, I didn't do it. I got a really wonderful recipe maker. So it's a pretty book. It's a pretty book.
Yeah, you have some really good books. And that's really what I love about you is you're really one of those proactive doctors who I think that's why you are so much in the forefront is because you're not just a surgery pharmaceutical person. You're so passionate about plant-based, which I personally think this is the only way to live as a human, because the proof's in the pudding, right?
And it's plant-based in diet as an option, plant forward, plant strong, plant complete, whatever you want.
Right.
But it's, as you're such an expert, I mean, I use lots of plant-based supplements, powders, capsules, tinctures. I'm suddenly a master on the science of full spectrum hemp oil because anxiety right now, my God, every patient I see is, first thing out of their mouth, I'm not sleeping, I'm anxious, world politics, health concerns, masks. You're a working family, your kids are at home. I mean, I don't have to tell you, my kids are grown, but it's a whole new world of trying to balance and stay sane. So
it is.
The solution isn't prescription drugs. The solution is, what you do, or saffron, ashwagandha, or something as natural and as safe as possible.
Yeah, I totally agree. Well, so people want to know how to find you. Where is the easiest way to connect with you, or the multiple places that people can find you?
Yeah, and I have one central website is easiest, drjoelkahn.com, drjoelkahn.com. Link to my clinic, link to my podcast. I do own a plant-based restaurant in Detroit, little link to that. Labor of love, but more labor than love. It's restaurant business is, one of the more difficult businesses in the world right now. Just what's going on. But
awesome.
This is good. And we're going to create a vitamin or a supplement or a natural tonic or
I would love that because well, that's kind of like what I think I inherited this gene from my dad as far as he was a master formulator, and since he passed on, it's been 22 years now, one of my biggest joys is formulating, and I never really knew that until after my dad passed away and I restarted his company. It was kind of like there's a lot of inspiration that comes from my research, and I have all this background of what I've loved about nutrition and diet, and I used to own my own health club. So for 20 years I was in the gym. I still love the gym, even though I'm not in the gym right now. But so there's this whole accumulation of
nature's amazing.
And nature is amazing.
I've been reading about pomegranates this past week, and there's been data about pomegranates as a very healthy. They can lower cholesterol. They can reduce, your oxidative stress. There's actually some new anti-aging data about pomegranates and extracts of pomegranates. It's just fascinating, and it's cutting edge science. So it goes back to healthy lifestyle, healthy foods, bright colors.
Well, it's Mother Nature. My biggest thing right now is watermelons. I'm eating so much watermelon right now because it's just all coming out. It's fresh. There's some organic places I get it where I live. And
cherish you. It's one of the top sex promoting foods on the list. I don't know if you know that.
You know what? I did not know that.
The rind of watermelon is very rich in citrulline. Citrulline helps you make more nitric oxide, which naturally lowers your blood pressure, protects your arteries, improves your brain function. But it's basically Viagra naturally, citrulline.
But the rind.
But when you get down to the watermelon, you get to the white. Actually, yellow has more than red watermelon, but we mainly eat the red watermelon.
Okay.
guys, gals, just scoop up a little bit of the rind and put that in your smoothie, or eat it.
Okay.
Yeah.
Okay. Good to
Yeah.
know. Well, I learned something really beautiful at the very end of this.
Yeah.
But Dr. Kahn, I adore you. Thank
Similar.
you for
Beautiful.
taking your time.
One day in the future, we'll actually maybe see each other again.
Yeah, that would be great. Because I know every time that we've gotten together at these different events we go to, it's always like, oh, you're just one of my favorite people and always have been. So I really appreciate the time you took to record this with me and provide some motivation and inspiration, and just the fact that it's so critical that, especially now, I think we're kind of reaching a tipping point with the health of the planet, that it's more critical than ever that we take care of our health, our responsibility, and it's partly taking care of the planet with our less consumption of animal products. So it's not just good for our bodies, but it's good for our planet too. So
Couldn't have closed it any better than that.
well, you're great. I'll put all the links to the books that you mentioned, and I'll also put your website so people can find you if they need to. But have an amazing day, and thanks everyone for tuning in, and we'll talk to you soon.
Bye-bye.